Hi there. Maybe you have done yoga before, maybe you haven't. Maybe that word just makes you think, oh, I can't reach my ankle behind my head. That's what yoga is, right? But no, yoga is actually just more about the breath being connected to the movement. And today, that's what we're going to do. We're just going to breathe and let our breath move as our body moves. And so, one of the things that we're going to just really focus on is whatever our intention is for this short, like 10-minute practice. And you can actually call it movement and breath. If you don't want to use the word yoga, that's totally fine. What we're going to do to start off, if you have a chair or something that's nearby that makes you feel steady, secure, because we know after brain injury, sometimes balance can be a little difficult. So you can have a chair beside you, or you can have your chair in front of you, whatever you feel comfortable with. But we're going to start standing, and then we're going to sit down for most of our movement today. So first, stand by whatever makes you feel secure, and let's just if you can be barefoot, that would be best, because we want to just feel the all four corners of our feet ground down into the earth, whether that's your floor, your carpet, maybe you're outdoors, maybe it's grass, wherever you are. Just let the bottoms of your feet settle into the ground, and notice how your feet hold you. And then just notice your breath. Notice how quickly you breathe or how slowly you breathe. Just notice that. And now bring your hands, palms forward, down to the sides. And if you're seated right now, that is totally fine. Bring the hands down to the sides. Notice the breath. Maybe your eyes are open, maybe they're closed. Just let your breath be natural. And now think for just a minute, what would you like your intention for this short practice to be? Maybe it's calm. Maybe you'd like to walk away from this practice just feeling a little more settled. Or maybe it's focus. Maybe you have something to do today that is going to require some focused attention. So maybe that's your intention, is focus. Maybe it's gratitude. Maybe it's, I just want these next few moments to, with every breath, to just remember what I'm grateful for in this day, in this moment. Now, if your eyes were closed, maybe open them and make your way down to your chair. If you're not in a chair, maybe you're on a yoga mat, maybe you're on your bed, wherever it is that you feel comfortable today, we're going to go ahead and remember what your intention is. And as we breathe in, we're going to take a deep breath, let the belly just inflate like a balloon. So we want the breath to be deep. Inhale, let the belly inflate like a balloon, and exhale slowly through the nose, in through the nose. Belly expands and out through the nose. In through the nose and out through the nose. I like to keep my eyes closed when I do my meditations, my movement, just because it helps me kind of just stay focused right here. But you do whatever you feel comfortable with. So now that we know what our intention is, whatever that is for you, just let that settle in as we go through our gentle movement. And nothing at all is going to require lots of effort, because right now all we want is to just gently move our body and let our breath follow the movement follow the breath, and just give ourselves this gift to just be in this moment. Let our mind settle, our body settle. So now that we're just here, we're in our breath space, our movement space, let your arms just reach overhead, any amount, whatever works for you. I have frozen shoulder, so it is hard for me to get up here. Inhale and exhale the arms back down. Inhale, arms overhead. Exhale, release the arms. And one more time, inhale the arms overhead. And exhale, let the arms relax by the sides. And now let the shoulders just reach up towards your ears and then move back toward the spine and down, like you're drawing circles on the sides of the room. So we're going forward, up, back, and down. We'll do that a couple more times. Forward, up, back, and down. And one more. Forward, up, back, and down. Now let's reverse it. And we go forward, down, and back. Up toward the ears, forward, down, and back. One more toward the ears, forward, down, and back. Now lift the shoulders up toward the ears and then just let them fall. One more time, lift the shoulders up toward the ears and then just relax them. Now, whatever amount works for your neck, maybe you don't have full range of motion, and that's fine. We don't want to push anything. So we want to just gently glance to your right. I'm going to my right. And back to center. To my left. Back to center. Right. Center, left, center. Now just let the chin drop to the chest, any amount, and then roll the chin up toward the right shoulder. And let the chin rest again on the chest and lift up toward the left shoulder. Chin drops toward the chest and round it up toward the right shoulder. Drops toward the chest and up toward the left shoulder. And now back toward the center and lift up the head. And now, again, if this works for you, you're welcome to do it. If it doesn't work for your neck, just breathe. So I'm going to gently drop my left ear toward my left shoulder. And I'm making sure I'm not cranking here. I'm not crunching. I'm really trying to find some length in the right side. So I'm pretending that there's a string from the top of my head to the ceiling. It's kind of pulling me up, kind of lengthening my spine. And then I just drop my left ear over. And if you want, you can take your right hand, take your fingertips out to the side and feel the stretch from the fingertips up through the neck. And then gently come back to center, and we'll do that on the other side. Find the length in the spine, that imaginary string. I'll say that a lot because we really want to lengthen the spine. And then we feel the length from the left side as we gently drop our right ear toward the right shoulder and maybe reach those left fingertips out to the side. And see if you can feel that stretch along the left side body. And then we come back to center.